My name is Mohammed Sawa. I'm the Chief Executive for Multicultural Arts and Media Centre. Can I welcome all of you to come to this cancer awareness session today. This is a great opportunity for us, for Multicultural Arts and Media Centre, to be working with Greater Manchester, Lancashire and South Cumbria Strategic Clinical Network to increase cancer awareness, and I hope this will be an opportunity where we can go further in creating and developing people so they can become cancer champions as well. IMAMC aims to engage with people on how to make information and cancer services more accessible to people from all communities. It's very important for us to promote cancer awareness, particularly in the South Asian communities too, as well, for many reasons, having the engagement, the context that we can provide to support organisations like the Strategic Clinical Network here.
Well, thank you very much to Mohammed inviting us down today. What we're here to do is just to get people's ideas and let's start talking about cancer in the community, because we know that prevention is a big thing. We need to be able for people to feel comfortable to go to their GP earlier if they have any signs and symptoms that they're afraid of, because if you're diagnosed earlier, your treatment is invariably better and your chance of survival is far greater. And we do have issues of a lot of people right across the Greater Manchester area, as well as here in Rochdale, of people not presenting early, so they live with the symptoms they're dealing with on a day-to-day basis, and then go to the GP too late for early treatment to actually take place and be effective. So we're going to do it as quite an interactive day because we want to get your ideas and your comments on what we need to do. So you're going to be given one of these booklets. We're going to give you 15 minutes. There should be pens on the table, I think. Yes. What we'd like people to do, only if you feel comfortable to do it, so don't worry if you don't want to. So if you open it up, there's a series of questions, and we just want your ideas and your thoughts. So again, if you don't feel comfortable filling some of it in, just leave it and move on to the next one. So what is cancer? Anyone want to give me a hand up and tell me?
Cancer is our illness, basically. What anyone could get.
You say it's an illness, anyone can get it.
Yeah, in your body.
Yeah.
Like brain.
Yeah.
And it's really difficult to get it out, basically.
Yeah. Well done. Thank you for saying that. There's a lot of proof out there that the earlier cancer is diagnosed and detected, the better your treatment and survival rate is. But the problem we've all got is how do we start talking to people about those signs and symptoms when people don't want to talk about cancer? Because that is an immediate barrier. So if we say the word cancer, what does it mean to you? What's the first word that comes into your mind?
Tumour.
Tumour. Yes?
Chemo.
Chemo.
Definitely scared.
You're scared? Yeah?
Recovery.
Recovery. Any others?
Painful.
Painful. The next thing we're going to do is we've discussed why these things happen, why we have these first thoughts in our mind. So what can we do to kind of make these words nicer in their meaning? They're not nice, but how can we make them a bit nicer than what we threw at? So tumour, dying, what can we do? Correct. So as soon as you have any concerns over your health, well done, you go to your GP. We're going to talk about, again, back to some group work, are possible symptoms of cancer. So we're going to give you 10 minutes. So we'll give you some paper if you want some paper to write them down. You can think of as many symptoms of cancer that you know of.
Slow recovery from exercise or loss of energy.
Persistent coughing with slight blood discharge. Yeah, that's true.
What would we go to the doctor with that are possible symptoms of cancer? So what on this table?
Weight loss and
What?
fat loss.
Oh, we've got weight loss, loss of appetite, hair loss. We've got any others, and we'll come back to you if we've no other new ones.
Which are different. Yeah.
Tiredness,
Mold changes.
mole changes, yeah,
Frequent infections and the hereditary element of it.
right, so family history.
And I'm delighted to welcome Dr. Chris Duffy, who is also the chair for Haywood, Milton and Rochdale Clinical Commissioning Group.
Thank you very much for inviting me along to this event, and it's great to see so many people turning up for it. Cancer is one of the biggest killers we've got in HMR, so seeing a forum like this where we can get information across what you can do for yourself, how you can improve things, is fantastic. So I'm more than willing to be a part of it. The local problem that we've got high rates of all cancers compared to national rates of diagnosis. So we've got 444 per 100,000 population diagnosed with cancers every year compared to a national number of 398. Lung cancer is one of the biggest killers we've got in the area, 66 per 100,000 compared to 48 nationally. Bowel cancer is about the same as ours, but still a high number of 45. For some reason, prostate cancer is very high in HMR, and nobody really knows. There's a higher incidence in West Indian population, but we've not got a massive West Indian population, but we have got a high incidence of prostate cancer. Breast cancer, again, slightly lower than the national average, but again, still higher than we'd like it to be. Commonest cancers in men, prostate, lung and bowel. In women, breast, lung and bowel. Nationally and locally, those 4 cancers account for about 50% of the diagnosis of cancers we get every year. Your risk of getting cancer, we're living longer. The longer you live, the more likely you are to get a cancer. 1975, approximately 25% chance of being diagnosed cancer over your lifetime. The 1990s went up to 33%. 2010 is at 40%. That's the chance of you being diagnosed with cancer. Fortunately, it's no longer the fatal diagnosis that it used to be. Survival rate, it's doubled in the last 40 years, expected to double again by 2030. Approximately 50% of people diagnosed with cancer now are expected to live more than 10 years. The Macmillan nurses, I don't know if there are any present today, used to be always associated with cancer and dying. They are now shifting their focus to help people live with the diagnosis of cancer. Cancer is becoming a long-term condition. It's not a death sentence, it's a long-term condition in a lot of cancers. Provided it's picked up early enough. These are the 10-year survival rates we get. Breast cancer, 78%. Bowel cancer, 57%. They're improving because there are screening programs available. But lung cancer, 5%, 10-year survival rate. And that is significantly better than it was when I was training at med school. If you got lung cancer at med school, you were lucky to survive 1 or 2 years. So 5% is better than it was, nowhere near as good as it needs to be going forward. How do we reduce the risks of you getting cancer? 4 big lifestyle things. Stop smoking. Smoking is the biggest link for lung cancer. It's also linked with stomach cancer, it's also linked with bowel cancer. It's linked with heart disease and all those major causes of death. But as far as cancer's going, stopping smoking is the biggest thing you can do. Losing weight, making sure you've got a normal body mass index, normal healthy weight. Decreasing your alcohol consumption. You've got a high incidence of liver cancer as a result of alcohol consumption. And using sunscreen. Rochdale is probably not high on your agenda for using sunscreen. What does tend to happen in a lot of English countries, we go abroad for 2 weeks, where it's sunny, don't put sunscreen on, get sunburnt, 20, 30 years later, we're getting skin cancers. How do you improve survival? 3 main reasons, ways you can improve survival. Early diagnosis, early diagnosis, early diagnosis. The sooner we catch cancer, the sooner we can treat it and cure it. Pushing on to say, these symptoms might be cancer. They may not, but if you've got them, go and see your doctor and get it checked out for cancer. For lung cancer, if you'd have a cough every day for more than 3 weeks, it could be cancer. It's more likely to be a chest infection. It can be asthma, it can be hay fever, it can be a whole range of things, but it could be cancer. Go to your GP does a chest x-ray. If your chest x-ray is fine, the chance of it being cancer are even less. Bowel cancer, blood in your poo, or even looser poo. If you go into opening your bowels, slightly more often than not, or if there's a bit of blood there, go and get it checked out. It could be cancer. Probably isn't, but probably is not good enough. You need to know that it isn't. Go and get it checked out. Breast cancer, we've got a screening programme for women with breast cancer. The screening programme runs from age 25 to age 64. That tends to give the impression that if you're over 64, you're all right, you're not going to get breast cancer. No, you can still get it over the age of 64. You need to look for different changes in your breast. You know what your breast size is normal. If there's any changes in it, any changes in the nipple, any lumps that you find, get it checked out. Just because you're not in the screening range doesn't mean you're not going to get cancer. Esophagus and stomach, persistent heartburn. Again, if you're 20, 25, you've got a lot of heartburn, it's probably because you're eating too much, drinking too much, or eating and drinking too much of the wrong stuff. 45, 55, it could be stomach cancer. It could just be heartburn. We should go and get it checked out.
It has been a fantastic morning, lots of information and lots of participation. Thank you very much for that. And the afternoon is going to be a very exciting one as well. I'm just going to present in terms of how the arts actually can help people through their mental health issues, people either with dementia, cancer, etc. What we've been doing over the past year or so, again supported by the SCN and HMRCCG, and better money from Awards for All, is to develop Arts for Dementia Therapy Network, bringing people together from organizations, from patients, users, and members of the public to come together and put some ideas how we can take forward the network. It is Northwest based, and we've got Davey here and a couple of other people who are actually part of the network. They've been very instrumental in terms of putting it together. We started off with about 14, 15 people, facilitated by some counsellors, and now on the books I think we got about 74 people that have joined. Am I right, Sarah? Yeah. And part of that was to develop the website for people that they can use in terms of training, sport, services, engaging with the different organizations. And it has really taken off for the past year. We've had a launch here of the network as well, attended by the mayor, the leader of the council, and the portfolio holder as well from the Council on Mental Health, and attended by the SCN. So this was an idea that we developed, and now sharing the same processes in terms of the cancer now to take the issue forward, and to help SCN and CCG to engage with the wider community in terms of our experience and knowledge is concerned within the Northwest. And arts, as you know, is a fantastic way of engaging people. And that's how we essentially come in. It's just, so it's a two-way thing, helping you to help us. And it's great because we are faced with issues, everybody is faced with these mental health issues. It's a society's issue. But then what do we do after that? We're not clinicians. We can tell you where to go and get the support from. But what do you do after that in terms of your time, your environment, etc.? So arts is a medium in which you can bring people together, you become less isolated, they enhance their skills, they share their skills and experience, and also bring people from different cultures. So what I'm going to do is already done it, Vikas, thank you very much, is just go through in terms of the benefits that you can actually gain by engaging with the arts and using arts as a therapy. And that is to the activities which you can build around people with the issues in terms of arts and health can actually promote the good health and well-being of not just individuals but communities, as they can see you taking part and they come and be part of you. Improve the mental, emotional and spiritual state of health service users. Create or improve environments in healthcare setting for staff and service users. Now this is very important, that if you can go in certain settings in terms of the colour, the way resources are set out, that you can straight away engage with, it makes all the difference. It's a welcoming environment for those people with the issues. And I want to just bring in how we can actually engage the BME community. And you've just seen an example of it today. For people to be engaged, they need to feel part of it in terms what is going on, is it translated, have got the right people to convey the message, and we've seen a perfect example of that today. And what we have found is that over the time that there is a lack of knowledge about cancer within the BME community, and I think Chris Duffy also highlighted the fact there is a problem out there that we need to sort of tackle in terms of the stigma and the taboo. There is a lack of targeted information for BME groups, lack of information, reference services for BME groups. Family are expected to take care. There are language problems. There's trust in service visitors. Older people are not engaged, not aware about the relevant services. Hopefully we can address that over time as well. I hope this will provide some information in terms of looking at future developments. So the engagement for BME communities would require recruitment of project staff and volunteers with bilingual skills and community knowledge, lack of transport and accessible venues, engaging older people from BME communities, partnership and agreements. It's important that we set out agreements within the communities to show that there will be a progression and people will have the duty between the organization to carry out those duties and tasks. Bring health professionals out of their mainstream premises, stroke offices, into community to meet with BME older people in local, accessible and trusted venues. Consult with BME older people on activities and talk to them about what challenges they face and work with service providers to help break down barriers. BME groups respond more positively to word of mouth or one-to-one personal promotion as opposed to more traditional poster leafleting methods or even using the internet. BME older people are more likely to engage with a project that has been recommended to them or legitimized by a religious leader or community champion. It is okay to use the religious leader and community champions, but make sure that they're aware of what this subject is about, so they're knowledgeable to be able to spread out that good message. We need to promote projects through ethnic media and places of worship, i.e. mosques, gurdwaras and temples. It's about supporting the organizations, it's about supporting staff, how they can actually help themselves to help the others. So everybody say tabla. I can't hear. Say tabla. Yeah, it's like being in primary school, isn't it? So tabla comes as a pair of drums. You have a right hand, which is made out of wood, left hand made out of metal. The skin is made out of goat skin, and the black spot is made out of charcoal and iron filings. Very tasty stuff. Don't recommend anybody eating it. You've got 3 different parts. 1, 2, 3. 1, 2, 3. Now each part makes a different sound. Na, tin, te te, tun, ka, kat, gha. So whatever you say, you make that sound. Everybody say dhada tete. Oh, very shy. I told you not to be shy. I told you that in the beginning. Dhada tete. Dhada tirikit. Dhada tirikit. Dhadin dhadin dha. Yeah, so whatever you say, you make that sound. Okay, so what I'm going to do is teach you how to clap a nation cycle, rhythmic cycle. Rhythmic cycles in nation music are called tars. Everybody say? Tars, very good. There are believed to be 108 different tars in nation music. After that, we'll have a go at one today. So you clap on one and wave on three. So that's the wave. I'll let you do it after two. 1, 2, 1, 2, 3, 4. 1, 2, 3, 4. 1, 2. Count. 3, 4. So what I'm going to do now is play that on the tablet. 1, 2, 3, 4. 1, 2, 3, 4. Okay, and the actual syllables are dhage nati nak dinna dhage nati nak dinna. I just put some magic powder on. It's Johnson's baby powder. Nice, isn't it?
Next one is last.
Okay, what I'm going to do is play lots of different patterns. Is what we call improvisation within the 4-beat cycle, which is called Keherva Tal. Yeah, and just enjoy the different sounds. Hopefully, I will make a bit slippery here, but.
Bowel cancer is the 4th most common cancer, but it's also one of the most easily treated cancers. So, how do you look for bowel cancer? Well, it's one of these kits. So everyone who's 60 until you're 74 receives one of these kits. This is a very simple kit. Now, for other types of cancers, whether it's for men and prostate cancer, or for women and breast or cervical, you need to go to a doctor, you need to see a nurse, you need to go to the hospital. The good thing about this kit is that it comes to your home, so you can do it with privacy and dignity at home. You don't need to tell anyone that you received the kit, you don't have to tell anyone that you've done the kit, you don't even have to tell anyone what the results were. After doing it, within 2 weeks, you'll receive your results. And out of every 100 kits, only 2 are asked for further investigation.
The training we're offering is full day and it will cover all cancers. So breast, bowel, lung, prostate, screening programs as well. Just so that people can go away and feel comfortable, not to do something like this in front of so many people, unless you really want to, but feel able to have a conversation in your community, so to be like the dementia champion, so you become a cancer champion. You're not diagnosing somebody, you're not telling them they've got cancer, they've not got cancer, you're just encouraging people to seek medical help.
I've been really interested in what's been talked about, and the fact that we've been able to do the question and answers. Very impressed that the doctor took time to come out to have a chat with us, because as you know, we do all find it a bit difficult to go and see a GP from time to time. And yeah, I feel, and I will be very honest now, from here at 10 to 3, I have a mammogram to go to now.
Oh.
I know, I'm going for a mammogram, which is a routine, fingers crossed. But I do feel better actually, yeah, knowing that the percentage, you know, of people having problems. So yeah, thank you very much for inviting us.
Thank you very much.
Done the Dementia Champions course, which is quite a structured and thorough event. I'm hoping that when I do the Cancer Champions course, it's a similar thing, that you are given a booklet with information about cancer, that it is a structured event. And in the Dementia Champions course, there's 5 key messages that we're required to get out there to tell people about. Hopefully there's a series of key messages that we're required to get out there to people on the Cancer Champions course as well. So I'm hoping that the two are quite similar in the way that they're structured. That I would feel comfortable delivering. I'm not an expert on dementia. I'm definitely not an expert on cancer. So hopefully it is quite structured.
Thank you.
So I found it a really interesting course. I've also sort of found out the interest about symptoms, and but more importantly, just the importance of that brief intervention, that short conversation, where you don't have to be an expert in cancer just to say to someone that you need to go to the GP. I think that's the more important thing.
The message from today for me is get those conversations going, bring it up, because as people in families and communities, workplaces, in the car with the children when they can't escape, we need to have those conversations.
In terms of the, as a health watch there, because you do lots of marketing and engagement with the communities, how did you felt the process of interacting with the BME? How do you think of the process that worked today for you, if any?
I think it worked very well, because obviously it's been well documented and well evidenced that there are barriers to working in the BME communities, and whatever we need to do, we need to engage with them to find out what those barriers are and how we can address them. So I think, yeah.
So does the translation side of things help?
Yes.
Councillor Billy Shearing. When I came along this morning, I was quite unsure of what I was to expect. What I have found out for the full session has been so informative. People have been so open, so focused on what cancer is all about. We've had terrific feedback from the NHS. Dr. Chris Duffy gave a statistical rundown of what the problems are with cancer. We all worry about cancer. Cancer is always one of those things which affect everybody in their lives. It could be themselves, it could be the relation. It's diagnosing it and doing it early, getting it sorted. Cancer is not the thing it was in the past. As soon as someone had cancer, then that was a fatality, and you knew that was going to happen. It's treatable now, and what we've got to do is educate people. The mixture of people we've had today from all ethnic backgrounds has been amazing. So the message is getting out there, and this morning has really been a revelation. Thoroughly enjoyed it, and I've learned something. Thank you very much indeed.
Together for Sarah. Claire. Martin, Dr. Chris Duffy, Ayaz, all my team please, all my volunteers and staff, and all of you for making this a success. Have a lovely week. See you very soon.